Good evening, everybody. My name is Dr. Mroueh. I'm a fertility specialist. I've been doing this for almost 31 years now. Uh, I'm very excited to be here tonight and to answer some of your questions. Please, you can type them and send them to us, and I'll try to answer them, you know, uh, to the best of my ability. I'm gonna get started now. So we already did receive some questions. And I'm going to start with the first one. The first question was, do you recommend not drinking, smoking, or exercising during the IVF process? And if so, how long before or after injections? I think part of the answer is pretty clear. Please do not smoke either before or during IVF. Many, many years ago, almost 30 years ago, we did an interesting study where we did IVF on people who smoke, and we checked the fluid that come with the eggs, and the fluid contain a lot of chemicals that are contained into cigarettes. So smoking can have definitely a toxic effect on the eggs of a woman. Uh, Drinking, you can still have a drink here and there. You're not pregnant yet. Hopefully, you're going to be pregnant very soon, and then no more drinking is allowed after that. But, if you can have a glass of wine to help you relax or something, that's perfectly fine. But again, just check with your doctor to make sure you don't have any contraindication. Exercise is definitely okay. Exercising is good. It might become uncomfortable once the eggs are growing, your ovaries are going to enlarge. You might be uncomfortable. After the egg retrieval, your doctor may ask you to limit the amount of exercise for a week or so. Again, just because your ovaries may be enlarged, it might be uncomfortable. And there's a very, very small chance that the ovary may twist and cause even more pain. So it's a good idea not to exercise after the egg retrieval and probably few days before that. Uh, but after you have the embryo implanted, it's okay to exercise somewhat. And once you're pregnant, exercising is okay. But the intensity of the exercise is going to change depending at what stage you are during the pregnancy, and your obstetrician will let you know about that. The second question I have, how does age factor in if you already had eggs frozen but are now ready to use? So the eggs are as good as the age that you froze them. In other words, let's assume you're now 45, but you froze your eggs at age 36. Basically, your chances of getting pregnant are almost similar to a woman who's 36-year-old rather than 45 years old. So the age of the egg is really what's important, and what played the most important role is at what age they were frozen. I have a question about freezing of unfertilized egg versus embryo, and what are the success rates? We are very good at freezing eggs, but we are even better at freezing embryos. What I'm trying to say here is that if you freeze 10 embryos and you thaw 10 embryos, probably all 10 or at least 9 of them are gonna thaw very, very well. If you freeze 10 eggs and you try to fertilize them, it's unclear how many eggs are gonna fertilize, but usually the thought is for every 6 eggs, you may end up with one embryo, depending on how old you are when the eggs were frozen, etc. So definitely, if you do have a partner, freezing eggs is a much, much better, freezing embryos, I'm sorry, is a much, much better idea than freezing eggs. Again, because if you freeze 2 embryos, you end up probably with 2 embryos. If you freeze 6 eggs, you may end up with 1, 2, 3 embryos. It's a little bit more unpredictable. So freezing embryos is definitely superior to freezing eggs. Just for the people who just join us late, My name is Dr. Mroueh. I'm a fertility specialist. I've been doing this for almost 35 years. I work at Boston IVF. My office location is in Rochester, New York, and in Syracuse, New York. And again, thank you for joining us today, and I will try to answer as many questions as I can. I have a question. Does TRICARE cover IVF? Unfortunately, I'm not too familiar with the insurance part. We have people in the office at Boston IVF who specialize in insurance. They will be able to answer all your questions, about what's covered, what's not, what are the costs, what's your deductible, and all of that. I got a question here about, is there anything I can do to improve egg quality? Unfortunately, that person had 3 failed IVF cycle. So, there is a lot of information out there on the internet, that are unfortunately not very reliable. Your egg quality is kind of your egg quality. Definitely, leading a healthy lifestyle, not smoking, watching your weight. There is some information that maybe taking CoQ10 or ADH might improve the egg quality. But at the end of the day, your egg quality is what it is. It depends on your age. It depends on how many eggs you have left. What is your FSH level? What is your AMH level? And that's honestly what's going to determine, the egg quality. As I said, leading a healthy lifestyle, not smoking, not using drugs, maybe taking CoQ10 and the AD8 and DHA may improve the quality. The the proof is not out there. We do recommend these because there are some studies that suggested that they might improve it, but those studies are not the most reliable. My next question is, for someone with blocked fallopian tube, if the IVF process doesn't work, is there a procedure to unblock the tubes? It really depends on how badly damaged are the tubes. A lot of time people have blocked tube. We can do surgery, a laparoscopy, try to open the tube, but it depends on the damage. Is the damage too much? Are they even fixable or not? So to answer your question, this is something, that your doctor will have to look into. They're gonna look at your hysterosalpingogram. More importantly, they're gonna look at what caused your tubes to be blocked, and then decide if surgery might help or not. But there is definitely multiple surgical procedure that could be performed to try to unblock the tube, but the success rate is going to depend again on why the tubes are blocked and how badly damaged they are. Is there anything to really improve egg quality with PCOS and not ovulating? I mean, with PCOS, weight loss is important if there's an issue with the weight, but patients with PCOS usually tend to do very, very well. There is some treatment that might help, maybe, treatment that might improve your insulin resistance, like metformin, might help. But again, people with PCOS tend to do very, very well with in vitro fertilization. We tend to get a good number of eggs. Good number of eggs usually translate into, a good number of embryos and hopefully a healthy pregnancy. But again, leading a healthy lifestyle, if somebody's overweight, trying to work on their weight, if somebody's diabetic or has pre-diabetes, controlling the blood sugar is very, very important. The next question is as follow. I had 3 rounds of IUI and 3 IVF cycle, and I was told that my eggs are fragile. I'm honestly not very sure how to answer that question. It really depends on the findings of the embryologist, what was wrong with the eggs, and if anything could be done to improve the quality of the eggs. Unfortunately, a lot of time, we do in vitro fertilization, we get eggs that either break down easily, they either break very easy during the process, they don't fertilize, and it's usually related to an egg quality. We try to change the protocol that we use to produce the eggs, which medications we're using, how much medication you're using, maybe delay the egg retrieval by a day or two to try to get more mature eggs, etc. But again, it's hard for me to answer that question because, it will be better answered by the embryologist and your doctor because, they're the one who did look at the eggs, they're the one who stimulated your ovaries. So yeah, I'm not able to answer that question accurately. The next question is as follow. Once a patient reaches 45 years, are you no longer willing to try IVF with her own eggs, even if lab work shows that her supply is good? This is always a dilemma. We want you to be pregnant. We want you to use your own eggs. The problem is when you look at the data out there and you look at the success rate of IVF in somebody who's older than 44, who's 45 or older, the success rate drops significantly. If you take like the national data and see how many women who are 45 years old had IVF and got pregnant, it's usually less than 10%, maybe even less than 5%. So it's not that we're not willing to do IVF. We just don't want to subject you to a process that has very low odds of success. But again, it depends on your specific condition. If your lab work show that you have a good number of eggs, it might definitely be worth a try. I'm sure you hear about women who are older who get pregnant spontaneously without any help. So it doesn't mean that your eggs are not gonna work. But again, we have to rely on statistics and on number. And at age 45, the chances of getting pregnant are very, very low. So the question is, do we put you through this whole process knowing that the chances might be less than 5%? So it's really a decision between you and your doctors if you want to embark on this journey and decide to proceed with IVF. And again, it's going to depend on your blood testing to see how good they are or they're not. Somebody asked, can you do PGT testing on already frozen embryo that weren't tested before freezing? Yes, we can do it, but we are thawing the embryo. We are doing a biopsy on the embryo. We are refreezing the embryo because we have to refreeze it to wait for the result of the biopsy, which may take 1, 2, sometimes even 3 weeks. So, freezing the embryo, thawing the embryo, refreezing the embryo, biopsying the embryo, the success rate is gonna drop significantly. So we do it sometimes, it depends on the patient's circumstances, but the success rate is gonna drop by, freezing, thawing the embryo, doing the biopsy, refreezing them, rethawing them. So we can do it. We do it frequently, I should say, in people who request it. But again, as long as you know that the success rate is gonna decrease because of all those procedures on the embryo. Are there any side effects of the IVF injections? Those medications have been used for many, many years. I mean, those medications, we started using them as early as the 1980s. So we feel that they are very safe. You have to remember that a medication like Gonal F, like Menopur, like Follistim, those are hormones that your body produces. We're just giving you a little bit more of it. So ideally, we don't think that there is any side effects for those medication. As I said, they've been used for more than 30 years now, 35 years, even more. And there has been no side effects from those medications reported. So I think at this point, those medications are pretty safe. Would I recommend that somebody use them for 20 cycles? Probably not. But what we know about those medication, the experience we have with them, the studies that have been done, they all report that those medications are very safe. Any long-term effects of taking injections hormone, how many rounds are safe? I mean, again, it depends on the patient's condition. Like we don't like, for example, to give Clomid for more than 6 cycles. There are studies that suggest that giving it for more than 10 cycles may not be a good idea. Uh, how many cycles are good? Again, it depends on your condition. I mean, usually if after 6 cycles of IVF, it didn't work, then it's time to reconsider why didn't it work? Was it a sperm issue? Was it an egg issue? Should we change the sperm? Should we get a sperm donor? Should we change the egg? Should we get an egg donor? So I think 6 cycle of IVF is a good limit, but again, it depends on your condition. Your doctor may advise you to stop after 1 or 2 cycles, depending on the result, or the doctor may tell you, you know what, let's do a 7th cycle just because you had a good response, you develop good embryos, but because of this, it might be smart to do one more. So it's really going to depend on your doctor and on your medical condition. Does age affect the quality of the sperm? Well, there is a lot of study about sperm and aging. And we know that as man ages, and we're talking when man is above the age of 50 years old, there is a decrease in the motility of the sperm. Basically, there is a decrease in the quality of the sperm, but there has been no study showing that the rate of fertilization, let's say your partner is 60-year-old and you guys are having in vitro fertilization, there are no studies that showed that using sperm from a 60-year-old guy, for example, is going to reduce the fertilization or is going to decrease the possibility of getting pregnant. But yes, the quality of the sperm does decrease with age. And I'm really talking not 40s or even 50s, more like 60 years old and higher. The quality of the sperm is going to decrease, but this does not seem to affect the success rate of infertility treatment. I have a question from a 47-year-old who got pregnant naturally at age 43. She froze eggs at age 38. I mean, you froze 6 eggs at age 38. I think the odds are good, because as I said before, the fact that you are 47 years old is not going to affect the chances of success because we're using the eggs of a 38-year-old woman. So your success rate is going to be the one of a 38-year-old woman who is undergoing in vitro fertilization. So I would like to think that, since you did get pregnant naturally at age 43, that you have good eggs, and those eggs that were frozen at an earlier age are good quality and are going to result in a successful pregnancy. So I would definitely advise that you proceed, if you want more children, to thaw those eggs and use them and expect, a decent result like any 38-year-old woman who's trying to get pregnant. What are the risks of pregnancy at age 47? Do women generally do well? As a woman gets older, we are concerned about complications of pregnancies. For example, women who are older than 45 has a higher incidence of C-section delivery. They have a higher incidence of high blood pressure during the pregnancy, maybe even an increased risk of gestational diabetes during the pregnancy. So it depends how healthy you are before you decide to get pregnant. If you are a 47-year-old woman who's healthy, who doesn't have any medical issues, I will assume that your pregnancy is going to be pretty much uncomplicated. But this is something, that your obstetrician will do in a preconception visit. They will meet with you before you decide to get pregnant. They will go over your health history and they will advise you what to do. If you're at risk for developing blood pressure complication during pregnancy, that may advise you to start taking baby aspirin during the pregnancy. So there will be a plan that your obstetrician will put together for when you're pregnant, how you will be followed up, what tests you need to be done, what are the concerns based on your specific medical history. But again, people who are 47, 48 undergo fertility treatment, they do get pregnant, and they do, with either eggs that have been frozen before or with donor eggs. And most of them do have a successful pregnancy. But again, it depends on your starting medical condition. How healthy are you to start with? A patient mentioned that she has type 2 diabetes and she's on Mounjaro, which is a medication that's very helpful in controlling type 2 diabetes, but also in helping people lose weight. Is there a time when I should stop taking Mounjaro before starting the IVF procedure? There is no enough information about the safety of Mounjaro during pregnancy. Same for Ozempic, same for all those medications that manage type 2 diabetes. So my recommendation, as long as your blood sugar is well controlled and you're ready to undergo in vitro fertilization, is probably to stop the Mounjaro, at the start of the in vitro fertilization cycle, and then not to restart it, until you are done with the pregnancy. That would be my recommendation. Your endocrinologist, the doctor who prescribed to you Mounjaro, and based on how well controlled your diabetes is, your hemoglobin A1C, how high it is, will advise you, in much more details than I can about exactly when to stop it. But definitely, let's say you find out tomorrow you're pregnant, you definitely need to stop the Mounjaro because, again, we don't know about the safety of Mounjaro, Ozempic, Zepbound, all those medications during pregnancy. So if you do get pregnant spontaneously, stop the Mounjaro immediately. If you plan to undergo IVF, my recommendation will be 2 weeks before you start, the egg retrieval. In other words, at the time when you start the injections, but your endocrinologist will be better able to advise you based on your specific medical condition. What is the upward age limit for parents who wish to work with a surrogate in order to have a baby? We would be using donor egg and sperm. Honestly, as long as you feel up to it, there is no age limit. There are things that you need to take into consideration. How old will you be when the kid is going to college? Will you be able to handle a kid? So your age is important from a social point of view rather than from a medical point of view, since you will not be using your egg or carrying the pregnancy yourself. But, I can remember patients. I remember a 64-year-old who got pregnant with donor egg. Unfortunately, she passed away at age 70, leaving twin orphans. So all those things need to be taken into consideration. But again, it's more of a social decision rather than a medical decision, since you will not be carrying the baby yourself and you will not be using your own egg. So, if you feel you're 50, let's say, and you're in good health and you're ready to raise the kids and run after them and take care of them, and help them go to college, sure, go for it. A patient is currently breastfeeding a 14-month-old, and she's trying to get pregnant again at age 42. Can breastfeeding and the release of prolactin affect fertility and/or implantation, even if day 21 progesterone is high enough that it indicates ovulation? So The problem with breastfeeding is that usually what it does, it increases the prolactin level, which basically stop you from having menstrual cycles. But when we talk about Irish twins, people use in the past, to be breastfeeding and get pregnant. So you can definitely get pregnant, but if you come to me asking me, hey, I want to get pregnant, I need to do IVF, then my recommendation is going to be to stop breastfeeding so we can monitor your cycle, put you on whatever medication you need to be on. And most of those medications are going to stop or decrease the amount of breast milk. I know you're a hero for, breastfeeding a 14-month-old. Kudos to you. What an amazing job you did. But I mean, you could get pregnant spontaneously, especially that you're ovulating, and you prove that you're ovulating by a very good progesterone level. So you can definitely conceive while breastfeeding, but if you plan to undergo any fertility treatment, the medication we're gonna give you are gonna stop the milk from coming out. My next question is, how important is lining thickness for successful transfer and live birth? So basically, lining thickness, every month a woman builds tissue inside her uterus, and that tissue is for a baby to implant. And if there is no pregnancy, the tissue comes out mixed with blood, and that's basically the period. So I always try to compare lining thickness to trying to plant a tree. If you want to plant a tree, you need good soil. You can't plant it on a stone or a rock. And the lining of the womb is kind of the same. We want a good lining, a thick lining. What does thick mean? Usually we like it to be 7 millimeter or more. Having said that, we've had pregnancies with 6 millimeter, with 5 millimeters, even with 4 millimeters. So lining of the uterus, the thickness is very, very important, but it's not the whole story either. But what I would like to see is 7 millimeter or more. For example, if I'm doing an embryo transfer and my patient lining is only 4 or 5 millimeter, I'm not gonna put an embryo in there because I don't feel that it is adequate, you know. And there are ways we can do to improve the thickness of the lining of the uterus. We can give estrogen, we can give aspirin. There are a few things that could be done to try to improve the lining of the uterus, but usually we like it to be 7 millimeter or more. How is IUI treatment cumulative, and what are the statistics around effectiveness? Like, why does it drop drastically after the third cycle? Well, the problem with IUI, it works. It works really well for a lot of people. And the success rate with IUI is never as good as in vitro fertilization. Why? Because, with in vitro, I'm looking at the egg, I'm looking at the sperm, I'm putting them together, I'm watching the embryo grow 1 day, 2 days, 3 days, 4 days, 5 days, I'm looking at the embryo to make sure it's healthy. And then I'm putting it back where it should be inside the uterus, compared with IUI, where I'm just putting sperm, hoping it's gonna make it to the egg, meet with the egg, fertilize the egg, produce an embryo. Then the embryo has to travel inside the tube until it reaches the womb. So that's why the success rate with IVF is always superior to an insemination. But to answer your question, the reason we say that we should stop after 3 cycles, it's not really a solid rule, but you get frustrated as a patient. We get frustrated as a physician, as a provider, because we really want you to get pregnant. And then we do it the first time, the second time, the third time. I mean, we have people who decided to continue with IUI and get pregnant after their fourth or even fifth cycle. And I know some insurances, especially in New York State, require that you do 6 IUI before they agree to cover IVF. So I don't want to say that the success rate of IUI is gonna drop significantly after the third cycle. But what I'm trying to say is that it gets frustrating for everyone. And because IVF gives such a much better success rate, after 3 IUI, we always think, what can we do to improve the odds? Yes, we can continue with IVF, but the success with IUI, but the success rate is gonna pretty much stay the same. After the second, the third, and the fourth, it's gonna pretty much stay the same, whereas IVF is gonna improve the success rate significantly. If you have a miscarriage from a naturally conceived pregnancy, how long would you have to wait before trying IVF for a 41-year-old woman? I mean, the sooner the better, you know. I know that in the past, people used to have a miscarriage and then the doctor will tell them, oh, you need to wait for 3 months or 6 months before trying to get pregnant. And the reason people used to say that because there was no ultrasounds available. So if a woman got pregnant immediately after a miscarriage, the doctor has no idea when you got pregnant, how pregnant are you, etc. But honestly, after you had a miscarriage, and you resume your menstrual cycle, which is usually 4 to 6 weeks later, you can definitely start treatment or even try to get pregnant by yourself. So let's say you miscarry last month and now your period is back, you can definitely try IVF now or try to get pregnant by yourself or try insemination. You really don't have to wait for 3 or 6 months to try again to get pregnant. Does ICSI increase the chance of embryo splitting into identical twins? Well, ICSI involved basically sticking its sperm inside an egg. And, identical twins happens because when we put an embryo inside the uterus, it's gonna divide equally, and you end up with children that come from the same egg and from the same sperm. Does ICSI increase the chances? I mean, we do ICSI when there's a reason to do it. In other words, when the sperm is bad, when there has been a poor fertilization before, when we plan to test the embryo for any specific diseases like cystic fibrosis, etc., we have to do ICSI. So ICSI is not done just for the purpose, of causing twins. It's done to improve the odds of getting pregnant under special circumstances, bad sperm, poor fertilization in a previous cycle, or if again we're checking for a specific disease, cystic fibrosis, spinal muscular atrophy, checking for a specific disease, then we have to do ICSI to improve fertilization and to be able to do the biopsy later on. I just want to mention, you can learn more about Boston IVF in New York by going to our website. It's called www.bivfnewyork.com. So it's pretty easy. B for Boston, IVF, the state of New York, and then .com, bivfnewyork.com. My next question, on average, how much does it cost for one cycle of IVF is one is paying out of pocket? It really depends again on what exactly is being done for you. Like, are you undergoing ICSI? Are you undergoing biopsy of the embryos? I'm not honestly that good at cost, I can tell you that Boston IVF in New York State, we have a program, not us, but we work with a company called Sunfish. It's an independent company who offer their services to our patients. And basically what Sunfish does, it does two things. Number one, you can pay some money and buy an insurance. You know how you buy insurance for your car? If you get in an accident, they will pay for the repair, etc. So Sunfish you can buy an insurance from them, and it depends on your age, how many eggs you have, etc., to ensure your IVF cycle. For example, if it doesn't work the first time, you don't get pregnant, they may cover your second cycle of IVF, etc. And I would recommend you look into that. It is called Sunfish. It's one word, Sunfish. And also they do give loans for people who cannot afford their IVF cycle. Again, they're not related to us. It's a company who contacted us and are offering services to patients who are going through the infertility process. Uh, they're interesting, to learn more. And if you go to our website, BIVF Network, you can find it there on our website. It's called Sunfish. It's one word, sun like the sun and fish like the fish that we eat. Would you suggest to use Myoinositol to help PCOS during IVF treatment for IVF, and any supplements or prenatal vitamin line you suggest? I will honestly recommend just a prenatal vitamin that contain enough folic acid. Inositol for people with PCOS have been shown to improve the odds slightly. It's not a magic medication, but there is a lot of information out there that using inositol, myoinositol may help a woman get pregnant, especially if she has a diagnosis with PCOS, or I should say, especially for women with PCOS. What is your view on ERA testing? So ERA testing means that a woman has frozen embryos, and what we do a biopsy of the uterus. We call it an endometrial biopsy. It's a procedure that may take a minute or two to do. Basically, we take a piece of tissue from the inside of the uterus, and what we do with this piece of tissue, we send it to the lab. And what the lab tell us are two things. Number one, they tell us the exact timing that this biopsy was done. Let me give you an example. When we do an embryo transfer, a frozen embryo transfer, we like to give people 5 days of progesterone because the embryo was frozen on day 5. So we give 5 days of progesterone and we transfer the embryo. By doing the biopsy, the lab is able to tell me if the lining was really a day 5 lining. In other words, if the lining is adequate to implant the embryo, or do I have to wait an extra day or 12 hours, or do the transfer 12 hours before, 12 hours late. So that's basically what the biopsy does. In addition, some labs also check for some chemicals that may imply that you have endometriosis of the uterus. And what that means, it means endometriosis may decrease the chances of implantation. And if we have that information, we can try to control the endometriosis over a month, 2 months, 3 months before we put the embryo inside. Now, there is still a lot of controversy about this ERA testing. Honestly, I personally do not use it unless I put a good, healthy embryo in a woman and she doesn't get pregnant. Then you start wondering, I put a normal embryo inside, why didn't she get pregnant? And then you start thinking maybe there is a problem with the lining of the uterus, and maybe then I might decide to do a biopsy and send it. I wouldn't do it honestly from the beginning. In other words, if the woman did not have a healthy embryo placed inside and did not get pregnant, I don't feel that it's necessary. Some other doctor may disagree with that. I think though, if I put a healthy embryo once, maybe even twice, and there is no pregnancy, then I may elect to do this test. It's still a little bit controversial about how useful it is in helping a woman get pregnant. My next question is, a patient conceived 2 children naturally, then she found out that she had a uterine septum that may have resulted in 2 miscarriages. So now that lady is 31-year-old and she's struggling to get pregnant. Should we proceed? Can we get pregnant naturally? Should we have an IVF cycle? So it used to be in the past that if somebody has a septum, we use to recommend to remove it. The issue is that most people who come to us with a septum are people who got pregnant yet had miscarriages. In your case, you had two children naturally, so I'm not really sure how much the septum is playing a role in causing your miscarriages, you know? So my recommendation, if you're unable to get pregnant naturally again, to seek infertility advice. Your doctor may decide based on the two miscarriages to remove the septum. Usually, it's really not a big major surgery to remove it. The recommendation, though, let's say I see somebody who come to me and she didn't try to get pregnant and she has a septum. A lot of time we tell those patients try to get pregnant naturally, and only if there's a problem, then we will take the septum away. In your case, again, you were able to carry two children without any problem. I'm not really sure that removing the septum is going to help. But again, it depends. You're going to need to be evaluated why you had those two miscarriages and why you're not getting pregnant now, and if you need any treatment for that. My next question is there a cutoff age for IVF? Again, we prefer not to do IVF on women who are 45 years old or older, not because we don't want to do it, not because we don't want to help you, but again, just because the success rate is low, But sometimes also, we see somebody who's younger and who doesn't have egg, and we recommend that they don't do IVF because we feel it's going to be a waste of their time. But usually, we do recommend women who are 45 and above to consider donor egg, because the success rate is much better. But again, everybody's circumstances are unique. And, we may test you, we may find that you have amazing ovarian reserve, and we may decide that it might be worth a try to do a cycle of IVF. Does having an orgasm help sperm enter the uterus? If you're not orgasming, are you less likely to get pregnant? This is pretty controversial. I mean, people get pregnant all the time, even if they haven't experienced an orgasm or even they don't have an orgasm. There was some suggestion that having an orgasm may help push the sperm up inside the uterus. In other words, help the sperm reach the egg and, maybe improve the odds of fertility. But again, this is just something that is open to discussion rather than 100% fact. And again, so many women get pregnant without having an orgasm. Is it possible to successfully have an IVF cycle at age 39? Already failed two IVF? I mean, definitely 39 is not old to get pregnant. At age 39, we expect that you have some healthy eggs. But again, it depends why, unfortunately, your two prior IVF cycle did not work. It depends on what your ovarian reserve is. And honestly, this is something that your doctor might better be able, to advise you about, because I don't have this information about why the IVF failed and about what your ovarian reserve is. But a woman who's 39, 40, 41, 42 should be able to get pregnant. The success of IVF cycle and this age group are pretty good. And so age 39 by itself is not a contraindication to IVF or not becoming pregnant. Can you go right from a failed IVF, IUI to IVF the next month? You can. There are few things, though, that need to be taken into account. Number one is the clinic where you're having care able to accommodate you. But also, more importantly, sometimes we need to prepare you for IVF. In other words, we may need to put you on oral contraceptive for a few weeks before starting the ovarian stimulation. So it depends on what kind of treatment protocol you're undergoing. It depends on the availability of the clinic, and can they move you straight into from IUI to IVF. I don't honestly see why it cannot be done, but again, it depends on the clinic circumstances, the availability, of space for you to proceed with it. And it depends on which protocol you're going to be on, because some protocols require that you be put on a medication called Lupron, or on oral contraceptives, or on estrogen. So it depends on which protocol you're undergoing. And honestly, I don't think it needs to be rushed. I know is of the essence, but if the IVF is delayed 2 to 3 weeks, and you are prepared better for that procedure, then it's better to wait 2 to 3 weeks rather than jumping into it. How many rounds of IUI before switching to IVF is recommended? You know, Again, it depends on your medical condition. It depends on your age. If you are older, if you don't have too many eggs left, then maybe 3 cycles at the most, and then moving to IVF. If you're young, let's say you're in your 20s, and the reason you're not getting pregnant is because you're not ovulating, then, 3, 6 cycles of IUI will be fine. So it really depends on your age, how many eggs you have left, and again, the cause of your infertility. Why don't doctors prescribe pain medicine for many in-office procedures? We do, depending which procedure you're undergoing. If you're undergoing FemView, we may ask you. FemView is a test to make sure that the uterus is normal on the inside and able to accommodate a baby, but also to make sure if your tubes are open or not. It can be uncomfortable because anytime you put something inside the womb, the reaction of the womb is to cramp to get rid of the something. The reason people have cramps during their menstrual cycle because the womb is trying to get rid of the blood that's inside, it's cramping to get rid of it. And the reason a lot of women, after they had a baby the natural way, in other words, not a C-section, have less pain with their period is because the opening of the womb is bigger, so the blood is able to go out easily without too much cramping. So the reason there is pain when we do those procedures, FemView, hysterosalpingogram, etc., depends if you had children before or not, if you deliver vaginally or by C-section, if your periods are painful to start with or not. Usually we ask people to take, Motrin, Advil before the procedure, 30 minutes, to try to minimize the pain associated with those procedures. But honestly, giving you like local anesthesia for those procedures may end up being much more painful, injecting a needle, injecting the anesthesia, and all of that may end up being more painful. But again, if you have severe cramps, if you had procedure before that were painful, tell your doctor, and I'm sure they can give you anesthesia, or they can give you some medication to try to reduce the pain. What are the tests being done on embryos to find a healthy embryo for implantation? So the first thing is, when an embryo is there, the first thing is the embryologist looking at it and grading that embryo. The best information we get is from our embryologists. They have a lot of experience. They've been doing this forever. They know exactly what a good embryo looks like. And they will tell us, we have 4 embryos. They all look good. They're all, great, so and so. So just by looking at the embryo, we can have an idea, but by looking at it, we cannot tell if it's genetically normal. It could have Down syndrome, it could have extra chromosome, it could be lacking chromosome. And the only way to find this out is to do a biopsy. In other words, the embryologist is gonna take some cells from the embryo. Those cells are going to be sent to a special lab, and those cells are going to be analyzed. They're going to tell us this baby is a boy, this embryo is a boy, this embryo is a girl, this embryo has trisomy 21 like Down syndrome, this embryo is abnormal, is not consistent with life. So the way to find out if the embryo is genetically normal or not is to do the biopsy, what we call PGTA, or pre-implantation genetic testing. So again, that's the only way to find out if it is genetically normal. Now, some of those embryos may not result in a pregnancy because not only are genetics important, but the development of the embryo inside your body is also important. But to answer the question, the best way to find out if the embryo is genetically normal is to do a biopsy, do pre-implantation genetic testing. Our next patient has said she had one natural miscarriage and a natural pregnancy. She has ovarian issue and male factor. The first IVF cycle that resulted in a miscarriage. The second cycle, the embryo did not stick. How to proceed with the third cycle? I would recommend, honestly, if you already have 2 cycles and you're not pregnant, it's going to be time to evaluate the embryos to see if they're normal or not, because that's the most common reason why people have miscarriages or why the embryo does not implant. So I would recommend, if you're doing IVF, to biopsy the embryo and check to see if the embryo is genetically normal or not. Our next patient is 41 years old and had 3 rounds of IVF and is considering now donor egg. Is this using donor egg gonna increase my chances of getting pregnant? I mean, definitely, because your age is not a factor. The eggs are usually taken from somebody who's young. The younger, the better. Usually the eggs are taken, 18 to 32. We like the egg donor to be younger. The younger, the better. I wouldn't, for example, work with an egg donor who's 40 or even 39, unless it's somebody related to you and you want to use your eggs. But if you're using eggs from somebody who's 20 years old, then your success rate is going to be like a person who's 20 years old. In other words, your success rate is going to be very, very good. Again, as long as there are no other factors that unfortunately resulted in failed IVF cycle. But your doctor will tell you that, if the doctor thinks that this is just an egg issue, your chances of getting pregnant are very, very good with the donor egg. And that's honestly the way to go. Our next patient said she has a hard time getting pregnant, but all the fertility testing was normal. She was able to get pregnant at 37, and this was a successful pregnancy. She's now 39. And the question is, how long should I try before being referred for IVF? The recommendation is, if you're younger than 36, try for a year. And if you're not pregnant, go see the doctor, the fertility doctor. If you're older than 36 or older, then try for 6 months. And if you're not getting pregnant, see the doctor. We get really frustrated when we see somebody who walk in our office and say, I've been trying for 5 to 6 years. If again, you tried for 1 year and it didn't work and you're younger, definitely seek care. If you're 36 or older and you've been trying for 6 months and it didn't work, definitely seek care. Now, if you know that there is an issue, you don't have your periods every month, your tubes are blocked, you don't need to wait 6 months or a year or anything. Just call your doctor immediately, because there is an issue that we should be able to manage. And I honestly would recommend seeing a fertility doctor immediately. We've had a lot of patients who unfortunately kept receiving medications by their gynecologists for years and 2 years, and a lot of time is wasted. Remember, your age is the most important factor. So again, if you're 36, in your case, you're 39 now, I would recommend, if after 6 months of trying you're not pregnant, please call a fertility specialist. And if you know that there might be an issue, you don't have to wait for 6 months. Somebody asked, how accurate is pre-implantation genetic testing? It is pretty accurate. My experience is anytime we put an embryo that was tested and the patient got pregnant and later on she got tested during the pregnancy, I don't remember ever that any of my patients ended up with a result different than what the pre-implantation genetic testing said. Having said that, when you do pre-implantation genetic testing, the result will come back, and at the bottom it will be written that we recommend that you get tested during pregnancy to make sure that the baby is normal. Why is that? Remember, when we biopsy the embryo, we take one cell, maybe two cells, but when an embryo is growing, when it's so early, there might be some abnormal cell, like some mosaic cell, etc., that are also present there. So the concern is that, number one, the biopsy did not recover enough cells, but that the lab will tell us if that's the issue. Or could the lab has misread the biopsy? It's really very, very unlikely. The technology is really excellent, but error could happen, and that's why the recommendation is, when you are pregnant, you know get tested again. There is no harm from that. Your doctor, when you're 11 weeks, can draw blood, check, make sure the baby is the gender that you wanted, that the baby doesn't carry any disease, that the genetics are normal. So to answer your question, pre-implantation genetic testing is very accurate. Is it 100%? Probably not. Error can happen all the time, but it's an amazing technique, and the result, I would say more than 95% of the time, are very, very reliable. Thank you so much, for joining us tonight. If you missed an answer, you will be able, to look at the full recording. It will be available. Uh, Again, I'm sorry that you have to go through this whole process. Uh, I hope, you will be able to build your family without too much hardship. I wish you the best. I have one last questions I'm going to answer right now. How many healthy embryos are implanted in one cycle? The recommendation is really to implant only one. People get very excited when they're pregnant with twins. And I have to say, as a fertility specialist, I do get excited too, but it's so much easier to carry one baby than to carry twins. Twins, you may deliver the baby too early. The babies may have complication, end up in the intensive care unit. A lot of issues can happen with twins. I don't want to be a pessimist, but it's always easier to carry one baby to deliver than one baby than to carry twins. For that reason, if we have a healthy embryo, the recommendation is to transfer only one. But again, your doctor will be discussing with you the quality of the embryo, if the embryos were tested or not, and will recommend, based on your age, how many to transfer. And we try to follow, or we always follow, the recommendation of the American Society for Reproductive Medicine. They have guidelines that tell us how many embryos to transfer. Again, thank you so much for your question. I hope I was able, to shed some light on this, I have to say, frustrating process. I wish you all the best. I wish you will complete your families without much hardship. Thank you again for listening. Have a good evening.